We made a few changes to our program that began on January 1st. So we're going to go through the details of that for you so that you can see the differences and we can highlight that. Did I step out of your frame here?
You're good. I'll move it. No, you're good. I'm just typing a little.
Okay, sorry, I kind of wandered.
You're good. Wander.
Okay, so we'll go ahead and get started. I like to go through some of the background of managed care in our state so that you can see where we've been before I explain where we have gone in our new program. So we'll move on to the next slide. So we start off with just the snapshot of Medicaid in Nebraska today. So we currently have approximately 237,000 enrollees, which is just a little over 12% of Nebraska's population. Those are all individuals who are part of Medicaid that are eligible for our programs. And that cost is approximately $2 billion. While $1.9 billion is the actual Medicaid healthcare costs for our individuals, the remainder is administrative costs. So the vast majority of our budget is actually to cover the expenses for all of our members. And we can move on to the next one. Okay, so I like to start off with just the basic explanation here of what is managed care. All of you might be familiar with managed care. I'm not sure. I see some nodding, so some people might be. So basically what it is we as the state, as DHHS, we contract with health plans to administer our programs, okay? So we often refer to them as managed care organizations or MCOs, basically because the state really loves acronyms, so we have an acronym for everything. For your benefit, I will try and just refer to them as health plans because that's what they are, and it's easier and something that we're all more familiar with. So we'll move on to the next one. Okay, so as I said, we've had managed care since 1995. And prior to January 1st of this year, we had 3 physical health programs. They were regional, which gave everyone a choice of 2 different healthcare plans. We then had a separate managed care entity for our behavioral health services. That was statewide. There was one contract. The contract was with Magellan. So behavioral health providers were used to dealing with one healthcare company. And then the pharmacy benefit manager was separated out by the state as well. So individuals who were enrolled in Medicaid were dealing with 3 different entities just to cover their basic health needs. So we wanted to integrate all of those into one, taking away that opportunity for disconnect, ideally for our members. So we actually have individuals in Medicaid that had 4 that they had to deal with if they qualified for our waiver. So that became rather cumbersome, as you can imagine, for anyone who was participating in our program. So we'll move on to the next one. And that's where we lead into Heritage Health, which is our new program. Now, there's been a lot of confusion with the name. For some reason, calling it Heritage Health has really stumped people. We get a lot of people that call us and say, are you Carmen with Heritage Health or Carmen with Medicaid? So Heritage Health is Medicaid. It's just the name for our new managed care program. So this is our integrated delivery system in which one health plan covers the physical, behavioral, and pharmacy services for that member. So we didn't enter into these changes lightly. We started back in 2015 is when we released our request for proposals for contracts with the new health plans. We awarded those contracts in the spring of last year, and then we spent the entire rest of the year last year going through readiness reviews with the health plans, testing their systems, integrating our system with theirs to make sure that we could deliver information and case files for individuals, making sure that it would be as smooth of a process as possible for all of our members. So that all led up to our go live on January 1 of 2017. So if we move on to the next one here. We had several goals when we set out to make the changes with Heritage Health. So the biggest goal that we had in this program was improved health outcomes for our members. So I'm sure most of you know when you interact with the Department of Health and Human Services, we are a huge agency. We have tons of programs for our members, but we're incredibly siloed. Given the nature of what we do, you have social workers that know the food stamp program or individuals that know the Medicaid program, but they don't know the nuances across the board. So in our contracts with the health plans, we have specifications in there for them to work with our sister agencies. So they will be conducting health risk assessments with any of our members so that they can determine what needs they have. So for example, if we have an individual who has a chronic condition, say that they're diabetic, but they're also homeless, they're not going to be able to control their diabetes if they're worried about where they're going to sleep tonight. So we have the health plans out there, boots on the ground, working with these individuals to determine those things. So they have homeless, I forget the name of there's
Housing navigators.
There we go. Housing navigators who are out there meeting with these individuals, finding out the needs that they have, and helping them find a place where they can live, helping them apply for the other programs for the state that they qualify for, helping them get that food assistance, energy assistance, things like that. So they're helping us with that because they have more manpower than we do. Obviously, as private companies, they have bigger budgets than we do. They have more staff. They can work different hours than state employees. So it really helps us expand our possibilities to outreach to all of our members. And then with our health plans, we have extensive contracts. When we moved into Heritage Health, obviously being in managed care for over 20 years, we've learned a lot of things. We've learned a lot about what we can manage and what we can't, what we can specify. So they have huge contracts. They're available on our website if you want really fascinating reading. I think they're like 2,000 pages each or something. But you can do word searches through them if there's something specific that you'd like to look for. And there's a lot of details in those contracts. They are held to very specific standards when it comes to customer satisfaction, and their HEDIS measures, and all of those are laid out within their contracts. And the person-centered approach is obviously one of the biggest features of Heritage Health, and that's where you get that integrated care. If we can put the patient in the center and bring all of the services that they need to them instead of sending them through different avenues to get what they need, it makes the process a lot better for them and has better health outcomes. So we can move on to the next one here. So our go live on January 1st was successful, and I say that because on January 1st, there were 225,746 individuals that were successfully transferred in the computer system from their old health plan to their new health plan. And that's not an easy task when you're dealing with a very ancient MMIS system in Medicaid, as well as 3 health plans that we hadn't interfaced outside of a testing environment. So that was a great win for all of us. And on May 1st, our enrollment had bumped up to 226,690. And I do have them separated by health plan so that you have a snapshot to see how many members each of the health plans have at this point in time. So you can move on. Okay, so one of the biggest features of Heritage Health is member choice. So last fall, we had an open enrollment period where every person who is in Medicaid could choose which health plan they wanted. So we have Nebraska Total Care, whose parent company is Centene. We have WellCare of Nebraska and United Healthcare Community Plan of Nebraska. And they were one of the regional incumbents, so some of the providers and members were familiar with them. So we had all 3 of the health plans laid out with all of the information so that members could choose. We have an enrollment broker who provides unbiased choice counseling to the members. So they sent out packets to all of the Medicaid members with the highlights and overviews of each of the programs so that they can make that choice. And they actually have choice counselors who are available to answer questions over the phone, online, by mail, whichever works best for the member. So they had, I believe it was about a month and a half to make their choice of which health plan they wanted. And if they didn't select a health plan, then they were placed into one. We used a algorithm within our system to plug them into the right program based on their providers, their location, and things like that. But that being said, no one was locked in with any of their health plans. So whether they chose their health plan or we selected one for them, everyone had 90 days to switch to a different health plan. So if they didn't like something about that health plan, they didn't feel they were getting the customer service that they wanted, they could switch over for any reason at all for 90 days. And that is actually still true. So if someone becomes eligible for Medicaid, say in July, they're going to have 90 days to make that change as well. So just because they're outside the open enrollment period and they didn't transfer with us at the beginning of the year, they're not going to lose that feature. And then going forward, we're going to have an open enrollment period every fall. So every fall, anyone can choose a new health plan for whatever reason they want. It would be similar to the open enrollment period that you would have in your place of business. So we're very excited about our online options for enrolling because it's new and so that's fun for us. But a lot of our members don't have that access. They don't have a computer to utilize to make those changes. So they can actually do all of this over the phone. There's choice counselors that'll go through all of the steps with them and get that filled out for them. They can do it by mail or by fax. And this is just a snapshot of what the web page looks like that our enrollment broker has for all of their enrollment or changing plans for any of those needs. So we can move on to the next one. Okay, so when we set out to implement Heritage Health, we wanted to be as transparent as possible and get as much feedback from everyone as we could. So obviously, when we have a member pool of over 200,000 people, this is a huge impact for a lot of individuals as well as a lot of providers. So we set out with 3 public committees that are still meeting today. They are on the public meeting calendar as well as our webpage, and anyone is welcome to participate. So in these committees, we have the sister divisions from DHHS, we have local groups, we have advocates and stakeholders from all around the state that are participating in those. The meetings are held in Lincoln, but we have 800 numbers for all of them. So anyone can call in and participate. We have a public comment portion at the end of every meeting so they can join us. So the 3 committees, we have the Administrative Simplification Committee. And the goal with that committee is really to make sure that we can streamline the processes. So for example, when we have 3 health plans, if they each have their own form that a provider has to fill out, in this forum, we can get together and say, is there a way to put these 3 forms into one, universal across the 3 health plans to make it faster and easier for providers? So that's some of the things that we do at that meeting. The Behavioral Health Integration Advisory Committee, putting behavioral health in with physical health was a big change primarily for providers. As I said in the past, they were just dealing with Magellan. They hadn't contracted with 3 health plans before, so this was a big switch for them. So we have regular meetings with the Behavioral Health Integration Advisory Committee to go through anything that we need to ease that process and make it easier for everyone. And then we have the Quality Management Committee. I mentioned in our giant contracts, we have all of these measures that they have to hit. That's going to be public. Everything that we are getting from the health plans, we are producing on our reporting page so that people can see how they're doing. They can see how many claims they're paying, how many claims they're rejecting, what kind of customer satisfaction they have. That's all going to be discussed in the quality management committees. So everyone's welcome to participate and come and hear how the health plans are doing. So we can move on to the next one. Okay, so as I've said, most of the people in Medicaid are under Heritage Health. We do have a few programs that are not part of Heritage Health at this time, so I do like to highlight those with everyone that I'm meeting with. So dental services. Dental services are still within Medicaid at this point in time in the fee-for-service program. Non-emergency transportation has not changed. The PASS program, personal assistant services, long-term care in a facility, that's going to be the custodial level of care, meaning the room and board for the members that are there. But the members themselves are in Heritage Health for their physical, behavioral, pharmacy services. And then home and community-based waiver services. So that waiver program for those that are eligible, that's still in our fee-for-service program. So I have this little image here on the side, and I know you can't see it in the slide deck, but I have it in there so that you know what it looks like, because it's a really valuable tool for everyone to access. It's on our webpage, and we call it the health plan comparison chart. So all 3 of the health plans provide the Medicaid required services, obviously. But since they are individual health plans, they have the ability to add value-added services that we as a state wouldn't be able to offer. And so we have a health plan comparison chart for you to look at those to help members make their choice. And those are going to range from all kinds of things, whether it's a Y membership or Weight Watchers or car seats for moms who participate in certain programs, or they have gift cards for people who go to a certain amount of wellness checks and things like that, things that will really help encourage that wellness and well-being for the member. So we can move on to the next one. Okay, so as I said, dental benefits are not part of Heritage Health, but given the timing of the year, I like to make sure that everybody knows what's going on. So Heritage Health was a huge project for Medicaid, but we decided to just have a whole bunch of huge projects on at once. So one of our other big endeavors is the dental benefits manager. So we actually just signed a contract with a company for our dental benefits that's previously been housed within Medicaid itself. So we're contracting that out. We signed our contract last week or the week before. So the go live right now for that is set for October 1st. So you'll be hearing a lot more about that in the coming weeks. They're going to be reaching out to providers to get them in their networks for the dental benefits for the fall. And as we move forward with that, we do have a web page dedicated specifically to the dental benefit manager, as well as an email address for people to submit any feedback or questions and things like that. So we have another big project that's going on, which is the long-term care redesign. And I mentioned that those waiver services are not part of Heritage Health. That's not because we feel that the long-term care waiver program is perfect and couldn't use any updates. It's a very extensive program that affects very vulnerable individuals, and we wanted to be very calculated in any changes that we make to that. So we embarked on a statewide tour last year with a contractor, just gathering feedback from individuals who participate in our long-term care waiver programs and asking for their feedback. What would they like to see? What would they like to see change? So that is still in process. The contractor submitted a draft plan, I believe in April. And we did another state tour taking feedback on their proposal of what changes they could make to the long-term care program, and they're still working on that. So we're still at a draft stage. We're still taking the feedback into consideration. They'll be coming up with a plan that should be published this summer. And we have a web page dedicated to redesign as well as an email address for them too. So the Heritage Health page was one of the first pages that we made specific to a program, and that is updated pretty much daily. I'm the one who updates it, so I can assure you it's updated all the time. You can visit there for any information. I have lots of one-pagers, highlights, fact sheets for members or providers, and all of those are available for download on our page. We also keep all of our press releases, the contracts, presentations from various events. You can access everything there. And you can subscribe to that webpage, and then if there's any significant changes or publications, you would get an email. If I go in and fix, spacing or a typo, you're not going to get an email. But if something major changes, you will. And we also have an email address for Heritage Health questions. It's a big program. It's affected a lot of different areas. And so we have a shared email account where you're going to get a bunch of subject matter experts with any question that you have, which will ensure that you get a faster response. So to email us with Heritage Health questions, it's just dhhs.heritagehealth@nebraska.gov. So now that you know everything there is to know about Heritage Health, I will pass the mic on to our health plans. I have a representative from each of our 3 health plans that have joined us today. They're going to give you some basic information about their program, and then we'll open up the forum for any questions that you guys might have for us, all right? So I'll move it over to United Healthcare.
All right, good morning. As Carmen mentioned, my name is Seth Richardson. I'm with United Healthcare Community Plan in Nebraska. Before we get started, I just want to make sure, is everyone in the room, are you guys all navigators or certified application counselors, or you guys work with those individuals? Is that, or most people, not everyone? Okay, more or less, yes or no? All right, good. So I guess I don't want to start off with, I think my supervisor asked me to do this presentation because I was a CAC a few years ago. So 2 years prior to, or I guess 2 years ago before I came to United Healthcare, I was at One World in Omaha. And so I've done hundreds of Medicaid and marketplace applications. So I feel for you. I feel you guys. I've been there. I know what that's like. So I guess we can go to the next page. So the first, I'd say 5-6 slides are going to be pretty high level. So I'm going to keep it that way. And then the rest of them, they're going to be more of our value-added benefits. I'm going to go into a little bit more details. Let's see here. So United Healthcare has been operational in the state of Nebraska since 1984. We've had a contract with the state of Nebraska with Medicaid for about 21 years now. Let's see here. Our mission is to help people live healthier lives, and our vision is to be the most trusted name in healthcare. Go to the next slide. Can we go back one more? All right, so at United Healthcare, we have 5 values that guide our United culture. So the first is integrity. That's really just doing what we say that we're going to do when we say that we're going to do it. We have innovation, which I've listed about 5 of our innovations, which I'm going to go into detail a little bit. Relationships. We understand that we have to build relationships with our community partners, such as you guys. Performance, and then compassion, which is what I feel like I identify with out of all of the 5 values. We can go into the next slide, please. This is what is Medicaid. I think that Carmen's presentation already highlighted all that, so we can probably skip that. All right, so whole person care. I think she also mentioned this. It's really important at United Healthcare to have the member at the center of the care plan and to be able to wrap all those services around that individual, depending on what need they have. She also mentioned we perform health risk assessments, HRAs, and based on those, we can identify certain needs that individuals have, whether that's food insecurity or housing or transportation. We can go ahead and move on to the next slide, please. Care management, we have experience with complex populations. We currently have Medicaid health plans in 26 states plus the District of Columbia, so we're able to leverage our national teams when it comes to care management, case management. It's the same thing. We can go into the next slide, please. Simplifying access to care. Pretty self-explanatory. We can skip past that too. Like I said, pretty high level. All right, now we're going to get into some more detail. So the next few slides are going to be our value-added services. So the first thing I want to mention is that we have zero copay for all services. You're not going to pay any copays when you're going to your doctor or to the pharmacy or any type of behavioral health provider. We have My Housing Connect, which is also one of our innovations. I spoke to innovation earlier. So we have a housing navigator on staff. She came from Heartland Family Service in Omaha. She did street outreach. She's boots on the ground. She's going on the railroad tracks, underneath bridges, meeting with our members where they are, assessing them and trying to get them into safe and affordable housing. Community support and resources. We have Healthify, which is a web-based application that can search for different social determinants of health. So say we have a care manager that's out in the field meeting with a member, they can pull up Healthify on their phone or their iPad, and they can search for food or housing or daycare or any type of service, any type of social determinant, and you can look that up by zip code. And so they can find resources that are local for that individual, and they can make those referrals. Like I mentioned, immunization, there's no copays, prescription, no copays, and then there are many over-the-counter products where there are also going to be no copays. Next slide, please. Behavioral health, as I mentioned, no copays, as well as our wellness visits. Health for Me is our mobile app. So instead of having to log on to myuhc.com to look up a provider, you can download that mobile app on your phone or on an iPad or any type of device. And you can look at providers. We don't send EOBs, but for me, I could look at my claims history on there. You can access nurse line information, which we have 24/7. And then wandering and elopement. This is another innovation. So what that means is, say a care manager that's assigned to someone that has an intellectual developmental disability, say they wander or elope during the middle of the night, then we can send them door alarms. So the care manager will send that referral over to me, and we'll verify the diagnosis, and then we'll send them door alarms that they can put on their windows and doors, so that the parents or caregivers don't have to worry about them wandering during the middle of the night. So it's one of our other innovations. Next slide, please. My Money Connect, which is actually really cool. So we're piloting this right now with our TANF population. So we sent out prepaid debit MasterCards to our members. And by going to a variety of different wellness appointments, we're going to load money onto that card that they can use for whatever they'd like. So just by going to taking your kid to their annual wellness visit, we'll put $25 onto that card, and they can take their kids to the movies if they want, or they can go to the grocery store and they can buy groceries. There's a variety of different wellness appointments. I don't know off the top of my head, but like I said, we're just piloting that right now with our TANF population. We're going to be rolling that out to our CHIP population, which is the majority of our members, and then later down the road, we're going to be including all of our members in that. Baby Blocks is another incentive program. It's for our pregnant moms or moms with new kiddos under the age of 15 months. By going to a variety of their appointments, prenatal and postpartum appointments, we will send them small gifts in the mail, such as just by signing up, they'll get a $20 gift card. We'll send outlet covers, little books, stuff like that, binkies. Healthy First Steps is just another program that supports our pregnant moms. And then community baby showers. We'll partner with local organizations, bring in a few different vendors, some resources in the area, let the moms visit with them. We'll have a health presentation that our EPSTD coordinator she can tailor. We just had one last week in Omaha at Liberty Elementary, and I think the school asked her to do it on what's the difference between ER versus urgent care. So the entire presentation was focused on when you should go to the ER versus when you should go into the urgent care. So we can tailor that presentation based on the need. Next slide, please. Text for Baby, which is another support for our pregnant moms. If they sign up for that, we'll send them text reminders about various appointments. Breast pumps, all 3 of the MCOs, we provide breast pumps. Programs are all a little bit different, but we all provide breast pumps. We are a national sponsor of 4-H, specifically Food Smart Families. So we partner with 4-H Council and our 4-H partners here in Nebraska. We're also a sponsor of the Sesame Street Workshop. So we have tons of just print material related to health and wellness, focused on parents being able to talk about health and wellness with their kiddos. We also have the ability to bring out either Elmo or Grover or I don't know, Cookie Monster, like a real life-size character from New York once a year to an event, which is really cool. We did that, I think it was a health fair in South Omaha. It was really fun. We brought out a big Elmo. Kids Health is just another resource it's a website for parents, kids, and teens that has information about a variety of topics, A to Z, you name it, it's on there. There's videos, there's games, there's articles. On My Way, it's another innovation. It is an app. It's an application for youth that are transitioning out of the foster care system. And so it's going to be teaching them basic things such as how to budget and things like that. I think there might be one more slide. Oh no, maybe that's it. So are we taking questions now or at the end?
We'll run through all the plans first.
All right, so if you have questions, write them down now so you don't forget them, and then we'll get back to that at the end. So thank you. Deanna?
Good morning. So do I need to stand over?
I'll go this way.
All right. Okay, good morning, everyone. I don't know if this is working, is it? Okay. My name is Kiana Mosby Brown, and I am the manager of the community relations team for WellCare of Nebraska. And as Carmen explained to everyone, we are one of the new health plans that rolled out on January 1st with the Heritage Health. So I will not have a PowerPoint today, but what I did bring with me was a resource folder for everyone to take with them. And what I'll do is just go over the resources that WellCare of Nebraska offers for our members, as well as what are the things that differentiate us from the other health plans that are out there. As Carmen mentioned, all of the medical services and all that, those are the things that the state mandates that we cover, so we all do the same thing. So what differentiates the health plans is how we go about delivering those services. So that would be the added benefits that we offer, that would be how our care management team goes about interacting with the members who need that complex health care and the team that is helping us, that member. So I'd like to start with our care management team. We have a fantastic care management team, and I'd like to start with them because from personal experience, I've had family members who've had to work with care management teams, who've had to work with organizations that pull together a group of people to get them the healthcare that they need, making sure that all of the services that are available, that they know about them and that they're able to get them. So our care management team, we have our field care management nurses who are out there connecting with people, connecting with the members, and making sure that they get the services that they need. So as I mentioned before, if there's someone out there with diabetes and they don't have healthy food in the house, we can try to manage that as best we can, but if they're not getting the services they need, it's kind of keeps them in a circular thing. So we have care managers who deal with foster care. We have care management who specialize for prenatal moms. We have care managers who specialize working with the diabetes population. So we have The care management team is also broken down into people specialized in certain areas. Anyone who is a member of WellCare can sign up to have a care manager. But as they are onboarded into WellCare, they will do a health risk assessment, and that will determine whether or not they will be offered care management services right out the gate. But like I said, they can also self-refer. So if there's a member out there who feels like they want those services, someone out there helping them to coordinate their care, they can call us and they can get those services. The other great thing about our care management team is that they are willing to meet our members and their personal team wherever they are. So if we need to go to the home and meet with them, if we want to meet somewhere out in the public, we can do that as well. They're all across the state, and we serve all 93 counties. So that's with our care management. The other side of that is we have 3 other teams that really do a great job of interacting with our members and interacting with the organizations that work with our members, say it that way. And so those teams are going to be our community advocacy team, we have our community relations team, and we also have our welcome room team. And I'll start with the welcome room team. We have 4 welcome rooms across the state. And those are brick and mortar buildings that any member or anyone from the community can visit and access many different kinds of services. So if there is an organization in the community that would like to have Boy Scouts or Girl Scouts meetings, diabetes meetings, for anyone from the American Diabetes Association, if there is an organization, so for example, Milkworks or something, and they want to have breastfeeding classes, these are spaces that are free to use, and they just go in or they call the welcome room in those areas, and they can schedule time to use that space. The welcome rooms are also great because they have conference rooms for organizations, so if you need to have a board meeting or a conference meeting, those rooms are available. I think they seat maybe 12 or so people, and they have audio-visual capabilities there. So you can connect with other people across the state. They don't all have to be in Omaha. If we need to WebEx them or video conference them, those capabilities are there as well. And they're also a hub for members. So if you are a WellCare member, if you have a client who's a WellCare member who needs help accessing the benefits, they can go into one of the welcome rooms and the coordinators there can help them change their PCP. They can help them order a new ID card, all kinds of questions. If they have questions just about their coverages or their services, they can use the welcome rooms to do that as well. So the welcome room staff, they're very knowledgeable. They know how to get our members where they need to go in regards to accessing those services. The welcome rooms, we have 4 across the state. Like I said, we have 1 in Scottsbluff, we have 1 in Kearney, we have 1 in Omaha, and we have 1 in Norfolk. There are also places where the community relations team, as we are out working with our members and working with the organizations that represent our members, there are an opportunity for us, we look for the opportunities, I should say, to listen, to figure out what the organizations are hearing that our members need, and then we might try to schedule an event or a program surrounding those needs. So an example of that would be in Omaha last month, we had a mini diabetes health fair. So we hear a lot surrounding diabetes needs, diabetes education for our members. So we had the Nebraska Methodist Mobile Diabetes Unit come to the Omaha workroom. We invited the whole community out to come use the unit to get A1C assessments. We had vendors inside who could do blood typing and just all things that related to educating our members about diabetes. So I'll go back a little bit. One of the great things that I found when I started working with WellCare was that our state president would always use the term one team. And I liked that because I thought, great, WellCare, this is great. We're going to work together as a team. But what I found as the months went by was that one team approach did not just, she wasn't talking just about the people that work within the WellCare walls. She was talking about our members who are always at the center of everything we do. They are the reason we get up and go to work, and we're trying to make sure that we're delivering the right services to them. She's talking about our state partners who are helping us to navigate how we work with those members, helping us to understand the contract. So we're all working as one team with the members at the center of that, making sure that we're doing the best that we can to deliver the right services at the right time to our members. So I'm going to open this up. So this is I'm going to hope that that I can talk loud enough. Can you guys still hear me without this? So I'll show you some things. Okay. Oh, yes, and I have them over here. And I was going to say you guys can take one when you leave, but it's been better you guys can follow along with me. So as they're getting those for you guys, I'll start with this. This is the best way for us to go through what we're doing. So we have our healthy rewards programs. As Carmen mentioned before, we all have our value-added benefits that we are able to bring to the table. And those are things that we believe are going to add value to the services that we offer our members. How we come to that decision, and I think how most of us come to that decision, NCOs, is that we're out there, we're listening to our members, we're listening to you guys as you're telling us what we believe that our members need. So if you look at this particular document, this is a way for our members for us to reward our members for taking the correct measures to get the preventative care they need. So we have a medically approved smoking cessation program. So after they complete the program, you'll get a $20 Visa debit or gift card. For people who enroll with WellCare, they will all do that health assessment and that health survey that we talked about. After completing that health assessment, they'll get a $10 gift card. For children's health, if they're doing their well visits, if they're doing their annual checkups, they're doing their adolescent checkups, again, those are all incentives that we're going to give them from $10 to $60, $25 for 3 to 6 year olds, $30 for 7 to 21 year olds. For healthy pregnancy, that's another big thing that we focus on. So healthy moms equal healthy babies. So if a woman is attending her prenatal care visits and they attend 6 or more, they can get a $25 gift card. And if they do their postpartum, sorry, this is way early. Their postpartum care visit, again, they'll get a $25 gift card. And if they complete all of those things, they can choose from a stroller, portable playpen, 6 packs of diapers. For diabetes health, again, we have completing your eye exam, a $20 gift card. Completing your A1C test, $20 gift card. We have our well women screenings. Again, there's gift cards for that. Adult health screening, so you're going to your annual checkup, you're going to be rewarded for that. And then even preventative dental care, even though the dental care is still with the state, we understand that healthy mouths, you're going to have a healthier body. And all of those things are really geared towards making sure that our members understand how important it is to take care of their preventative care, so we don't end up in the ER so much. So we're not constantly chasing, all of the different things that they might be dealing with. So the care managers are a great resource for our members, again, helping them to understand exactly what their particular benefits may be. The community relations team, their job is to go out and educate the organizations that work with our members, as well as members when we have the opportunity to educate them on what that all means. The other way that the community relations team gets involved with helping to make sure that people are using their benefits and understanding their benefits is that we'll have what we call concierge days. So with these benefits, you're going to call in, you'll do an attestation that you've done the checkups and that you've done what you needed to do. Then you'll call in and they'll get you set up through our know-you system to get those benefits. Sometimes it can be confusing to people. Sometimes they may not have access to the computers or whatever it is that they need to access those benefits. So the community relations team tries to work with organizations throughout the state to set up days where they will go in with their computers, and if members want to come in and get help with doing that, the community relations team is right there with their computer, helping them to order their gift cards and all of that. You see the second sheet is just another layer to the added benefits. So this is the sheet that you see right here. So along with the things that I just explained to you for the health rewards, we also offer hypoallergenic bedding for families and children with asthma. We also offer a $10 a month over-the-counter benefit. This is something that is really neat. If you look inside the folder, I brought you an example of our over-the-counter benefit booklet. So members get $10 a month. Their household gets $10 a month free to go through this booklet, and they can order any of the things in this booklet that they need. So from artificial tears, and actually it's interesting that it just popped up on that page because one of the community relations team members works with the Stevens Center in Omaha. And just last week, one of our members was there and needed help ordering something from this booklet. So she was able to show him right there on the spot that yes, you can order artificial tears. It's $4. I'll show you exactly how to do it. So they have a monthly appointment for her to come and meet with him at the beginning of the month and help him to place that order. So these are all of the things that members can order through the over-the-counter benefit. Again, the community relations team is there, and I can let everybody know like where they typically are across the state. Typically, it's going to be like maybe in the lobby of a WIC clinic. They have like a standing appointment where they set up a table and people can come in, either make an appointment ahead of time or just stop in during that time because they're there at the same time every month. So in addition to that, let's see, we have our Weight Watchers benefit. So if anyone would like to join Weight Watchers, we will pay for that. The smoking cessation, which I covered, and as well as discount cards. So each member will receive a discount card that they can use at different grocery stores or stores throughout their community. And we're constantly looking. I know in some of the more rural areas, it's a little bit more difficult to find the stores that we work with, but we're always reaching out to different stores, reaching out to different organizations to add them to that card. But so far, I think that everybody has been very pleased with using that card as well. So the other team that I will talk about is our community advocacy team. We have a team, we have 2 women who their sole job is to go out and meet with organizations to figure out what the organizations are hearing about the barriers to health that our would-be members or our members are experiencing. And then they work with those organizations to either help support them in their mission and bring that information back to WellCare so that we can upload it into our database. There's another card in here that I shared with you guys, and this is our community assistance line card. All of the information that the community advocacy team gathers when they're out there across the state goes back into our database. Any member that has a need that is not covered under the state's, what the state has us cover, or is not a part of our added benefit, can use this card and we can try to help them this way. So if it's housing, if they're looking for an organization that might pay for light bills, or they're looking for an organization that might help them with supplemental food for the rest of the month. So there's food banks and all of the different agencies across the state to help our member population get from month to month. We're compiling that information and it goes into the community assistance line. So if they were to call this number and there's a person on the line who will help get them connected to the correct service. The way they close that gap and close that circle is that they will follow up with the agency that they referred them to and follow up with that particular person and to make sure that they got the services that they need. So if we need to be reaching out and going out there and looking for other organizations, we're really wanting to make sure that we are advocating for our members. Sorry about that. Advocating, sound like a 12-year-old boy whose voice is changing. That we're advocating for our members and making sure that they are getting the things that they need. We can't do it all within just the contract and with the confines of what we're doing, but this is our way of trying to make sure that we are still out there helping our members. So the community assistant line is a fantastic way of helping our members to close those gaps and those barriers to health. The community advocacy team also helps to start coalitions across the state with different organizations who are helping our members. So for example, in believe in Lexington, they just had the first meeting for their dental coalition, and they're bringing everybody to the table. So all of the NCOs will be at the table, as well as the organizations who work with our members to build a coalition surrounding dental health. What can we do? What can we do to pull organizations together to help members get the services they need? Some of the same things that are around housing are happening in the Omaha area. We also have our community baby showers. So quarterly, we have 2 baby showers every quarter across the state. Our next one will be in partnership with the Winnebago Hospital, and so on the Indian reservations. But anyone is invited to join us at that baby shower. There's health education at the baby showers. There's opportunities for them to speak with some of the partners that we work with, like MilkWorks, to get information about breastfeeding and so on and so forth. We share that information as we make the dates for those different activities. So look for emails from any of the community relations team or any of the partners that we work with to give you guys an announcement for those things. And finally, let's see. Yeah, I'll just say that the community relations team, one of the other things that they're really good about doing is listening to the needs of the members, listening to the needs of the organizations that we work with, and developing programs that help to fit those needs. So one of the other things that we're doing right now is we've started a community garden in one of the South Omaha areas, because we know that there are, there's a large food desert there. So WellCare employees are out there. We're maintaining the garden. Hopefully we'll grow some stuff. And anyway, I'm not going to say it's looking bleak right now. It's looking pretty good. But all of the foods and vegetables that we grow will be donated back to the community and back to the people in those particular neighborhoods. And I'm hoping that it's something that will take off and there'll be a need, and we'll be able to do it across the state. Okay.
Thank you. Yeah. And we have Nebraska Total Care.
Oh, not me.
Not you. It's
Yeah,
Nebraska
I'm a
Total
welfare woman.
Oh, we're at the same things. I mix everybody up. I'm not sure. Okay, well, I'm not sure what happened to my NTC rep today, but we can go ahead and open it up for any questions that you might have for our group. Sure.
With the WellCare presentation, with the added benefits for the dental, since dental is not connected, has its separate Medicaid managed care. How though do you verify those preventative dental visits? Is there a connection that your systems are talking, or is that the responsibility of the patient?
So what the patient, really what they do is when they go on to the NOVU site to access that benefit, they just do an attestation there. Really, they say, I did it.
Okay.
And we trust that they did it. It's really that simple.
Okay, I'm just asking because we're a dental provider here at healthcare.
Yep, we try to make it as simple as possible
for the clients. And my other is just a comment. I noticed you have any preventive dental visit for all WellCare members age 2 to 21. Why age 2 at the beginning? With the American Dental Association, the American Academy of Pediatric Dentistry, they recommend the first visit by age 1, and we see them here at age 1 too. Because the earlier we can get to parents and infants, the better we have an opportunity to prevent early childhood caries and also to prevent those hospital cases. So I'm wondering, based on the recommended age by the American Dental Association, American Academy of Pediatric Dentistry, why not age 1?
I'm going to be honest and say I don't know.
Okay. Because we do here, even at age 1, we are applying fluoride varnishes, and there's a new technique, silver diamond. I mean, we're trying to keep kids going to the hospital.
Right.
And I know out of the 3, I heard from our pediatric dentist on site that does our hospital cases, kids that it's too late, that one of the programs does not cover hospitalization.
Okay.
And so the sooner we can get to those kids to prevent that. So I'd like that, just, something is for future.
That's perfect. I will definitely take that
That's
back.
to go by the recommendation.
Okay, that's wonderful. I will write that down and put that back.
And what I started to say, because there is silver diamond that now is kind of like a fluoride that if the decay has gotten into the debt, we can avoid some of those hospital cases by just even applying that and arrest the decay. So even on those really young, they're starting to use it on those really, really young kids as a tool to keep them out of the hospital, you know, those kind of things. So I would just, as a comment, look at that for future. Thank you. Thank you.
If we're having an event and we'd like to invite each of the 3 providers to come and be there, who are the contact people? You?
Yeah, I'll coordinate.
Okay.
Yep. Just let me know and I'll get a hold of everybody.
And can you give us your email again?
Sure. Carmen.Bachle@nebraska.gov. And my last name is Bachle. And Nebraska is all spelled out.
And you were talking about the initial enrollment when people are choosing plans. You listed the ways that folks are able to do that. I work with some families who would prefer to do face-to-face appointments. What options are there for that?
Face-to-face to enroll, they could go to a local office.
Just the local DHHS
Yeah.
office? I'm assuming they need an appointment?
That would vary from office to office. I think we do have some walk-in offices around the state.
Here in Lincoln, how would they contact someone to do that?
Well, so saying that they want to select their health plan in person or fill out their Medicaid application in person?
They want to select their healthcare plan and have someone do a face-to-face appointment with them.
Okay, I think that would be fine for them to contact the local office. As far as in Lincoln, I'm not sure how that works. They don't have walk-ins at the customer service center that I know of, so I don't know if they would just stop by the state office building and ask if someone could help them. I know we do have walk-ins down there, but typically we do encourage people to call because we can do it for them over the phone. And so if they called and they wanted something in person, they can request it then and set something up specific to them.
There's on the welfare, the welcome room. Did you talk about that? Did I miss it?
I did talk about it, but I can go over it again. So the welcome rooms are brick and mortar buildings. We have 4 of them across the state. We have one in Scottsbluff, Nebraska. We have one in Norfolk, Nebraska, one in Omaha, and one in Kearney. Nothing in Lincoln, no ma'am.
I know you guys all pay for breast pumps, but do you pay for appointments to see IBCLC, like the breastfeeding?
You're gonna have to help me. What's that acronym?
I know that that's come up before and it's based on medical need. It's medical necessity.
Lactation.
So like, if they need lactation support, the Medicaid will pay for it?
If they have medical necessity from a doctor, then that would be a covered service. But they have to have the medical necessity piece of it first. I know that came up. I was at a WIC conference and that was a really big discussion that came up for quite a while. So
So do you mean like a doc, like they need to go see their nurse practitioner or their doctor or whoever and get like info for, or I'm just a little curious.
I believe it was a referral that they were going to need that service.
You mentioned public data being available about the plan services. Has any of that data been released yet? And
Yes.
when will it be?
We started reporting on January 3rd.
Oh, wow.
So it's on the Heritage Health webpage. You can click on reports, and that is still evolving. Obviously, the more data that we gather, the better our graphs can be and things like that. So we'll be releasing new ones this week. Right now, the information that's up there is current through the beginning of March, and the reason that is we're trying to get much more sophisticated graphs now that we have a whole quarter to work with. So those will be posted as soon as I'm in the office long enough this week to post them. So
Great.
They're coming soon.
Say I appreciate the added incentives for Medicaid clients to get to their appointments, because that's obviously been an issue in the past and for them to make their appointments. So I really appreciate seeing that everyone's offering that. Again, and I don't know what the new, as I said, we're on the dental, or I'm involved with the dental side. And I hope the new managed care plan for the dental has some incentives as well, but I appreciate on the medical side that you, at least for those that have dental incentives, and if you don't, if you consider that. Obviously, there's a lot of research out there that connects oral health to your overall health and well-being, you know, the connectedness with diabetes and cardiovascular disease. So even changing the age from, you know, 1 as early as 1, but I saw 221, but even taking consideration for those who have chronic disease health issues, making sure that the importance of getting, you know, if they have diabetes, to getting to their dental visits, because if you have dental infection, that makes it more difficult for you to control your diabetes. And those who have diabetes are at a higher risk for, and I'm just giving an example, periodontal disease. And so it becomes a vicious cycle for those, you know, clients with chronic disease to control that. So again, if you can consideration for those, you know, looking at that differently from even older adults who have diabetes or heart disease, making sure there could be some kind of consideration for incentives, that would be great, because there is a lot of research that supports that, and even pregnant women, making sure they're getting to their preventing visits, but because they're at higher risk for preterm birth weight babies if they have periodontal disease. So any consideration for that in the future to look even broader at the dental incentives, because of the research out there, would be greatly appreciated. And we want them to show up their dental visits. And I know not as many adults are on Medicaid as many children, but again, for those that are, you know, with disabilities and things, it's just even more important for them to make their preventative visits and their restorative visits. So thank you for that consideration.
Any other questions for panelists?
Yes, I believe interpreters are free to use.
I'm sorry?
Interpreters?
Yes.
All free.
And there's information on the brochures here, and I'm sure on everyone's website, on how to get connected with an interpreter if you want those services.
Yes, yeah, Healthcare, we have language line.
Yeah.
It's free for y'all.
So does the provider call for interpreter, or can the client request for interpreter?
So the client can call themselves if they're working with a provider. So it really depends on the situation. I mean, if they're at home and they need to order a new ID card, they call themselves, and they would just let the member services person know that they need to work with an interpreter.
Do you have an option for like an agency to call on behalf of a patient or a client? For example, if we have the person in front of us, but that person cannot communicate because English is not the first language, but we are calling to the health plan on their behalf to request another card. We have their information because they're with us. Is that possible, or do the plans work with the agencies here, for example, you know, like the hospitals and like the local agencies here, like El Centro, for people need? If we identify ourselves, we're just calling to call the person requesting another card.
So typically, that can be a little bit sticky, but I think that the person has to be able to communicate that they are allowing this person to speak on their behalf. So they have to be able to communicate that to the member services representative.
I called Aetna one time to get a card for somebody, and I think they spoke Kurdish. And so I had to call Aetna. They got the Kurdish interpreter on the line. They conversed saying that it was okay that I spoke for him, and then they moved on. So
yeah.
Yeah, so a couple from me. Do we know when the Heritage Health open enrollment dates will be?
Yes, that's going to be released very soon. I
Okay.
can tell you that it's in the final quarter of the year, and it'll
That's
be
it, so
for about 45 days. So
Okay.
those dates will come out very soon.
Okay.
Okay, so people now at this point need to wait until open enrollment if they want to change their healthcare plan.
If they're past their initial 90 days as a member, yes. The only way that you can change outside of that time frame is a for-cause reason, which is explained in statute. And so basically, if they feel there's a reason that they should be able to switch plans, they submit that and it's reviewed by Medicaid. So an example of a for-cause reason perhaps would be their provider is no longer a Medicaid provider. They have switched doctors, and the only other doctor where they live that they want to go see isn't in the network for the provider or for the health plan that they're enrolled in at that time.
And then, so if a client is with the doctor and wants to change doctors, they do that by calling their healthcare plan.
So,
I mean, this is a different question, sorry.
Right,
Totally
right.
different question.
so they can see any doctor that's in the network for their healthcare plan. They're not locked into one.
They don't have
No.
like a.
And they do, there's been a little confusion because people do have their PCPs on their cards this year. And that's caused a lot more confusion than we had anticipated because people had taken that to mean that's the only person they can see, which is not true. They can see anyone that's in the network for their health plan. And if they don't like the name that's printed on their card, they can call and have a different doctor put on there as well.
Yeah,
So,
we prefer to have their current PCP on their current card, but as she mentioned, they don't have to just see that doctor.
Right.
As long as they're in our network, they can see that physician.
Yep.
Provider.
And like, then the clients can find out who's in the network by like visiting a website.
our enrollment broker maintains that. So that would be AHS's webpage is, I had it highlighted in my slide deck, but it's heritagehealth.com, whereas we are heritagehealth.gov. So that's the only difference. But you can link to their page directly from ours. There's a picture down at the bottom of every one of the Heritage Health pages that says member information. And if you click on that, it'll take you straight to our enrollment broker page.
You can also go to, at least for United Health, you can go onto our website and search for providers, and you can also call member services, and the member services can search for providers by zip code or in their area and do that search for them.
Yes, and the health plans all
And they can
have-
actually even call the doctor and set up the appointment for them too.
My one last question is just out of curiosity, how many people got like auto enrolled at the kickoff for January 1st? Like, was it like half the people, or did most people call in and select a healthcare plan? Or-
We had the highest number of self-selections we've ever had, which was fantastic. That was a wonderful outcome for us. I knew the numbers in January, and I don't know them off the top of my head. I want to say we were close to that halfway mark, which had been our goal. We were pretty close to that. So, and then I'm not sure if I highlighted that beginning on January 1st, we began passive enrollment. Did I talk about that? No, I'm seeing heads shake. Okay, so as of January 1st, we're now in passive enrollment, meaning if someone becomes eligible for Medicaid, they're automatically placed in a health plan. We do this for speed. Okay, so if they become eligible and we put them into a health plan, they're going to have coverage within 72 hours. And we want them to have that coverage right away. And that's why they have 90 days to change. So we're plugging them into the health plan that the algorithm thinks is the best fit for them, but they're not stuck with that. They can switch to a different one. So that's what we refer to as passive enrollment, meaning that they're automatically signed right up.
Would that hurt a patient, for example, if a patient goes to see a primary care that does not accept WellCare, and this person was automatically enrolled in WellCare, is that person going to be affected by it in the way that they're stuck with that medical bill, or?
That is the beauty of the algorithm, is it's going to plug them into someone who their provider is in their network. So they will make sure that that coverage is there.
With the passive enrollments then, if it was done, say, on the 10th of a month, does it activate immediately, or does it
If they are
activate the
new-
following month? If they're new to Medicaid?
Right, they're going to have that coverage within 72 hours of their enrollment date. As you know, when people apply for Medicaid, their start date may vary. You know, some people get retroactive enrollment and things like that. If you change your plan, that becomes effective the first day of the following month, because we do have to run it through our computer system, get the file over to the new health plan. So that's where it would be the following month.
So the passive enrollment initially, they could activate with the managed care plan in the middle of a month.
If that's their start date for Medicaid. If their start date for Medicaid is the first of the next month, that's when it would be. It just depends on when they start.
I had a question about the WellCare community assistance line. So when you're calling in, it says transportation services, only for their medical appointments, and that's connecting them with a Teleride, or this is WellCare's transportation?
Completely different. So understanding that the community assistance line is helping the community. Oh, and I will point out that it's not only for our members. So it is for anyone in the community that might need this assistance. So Telluride is still the same coverage. This is outside of that. And so this is the possibility that they can't get what they need. So it may end up being that it's not necessarily like to a medical appointment, I don't know. But they're needing transportation somewhere. We may have found an organization that offers that. So call the community assistance line and see if that is something that's available.
But I would reiterate that Telluride for the state has not changed, so they would still go through that.
So like for food and financial assistance, is it someone on the phone who's gonna do like an economic assistance application with them, or are they gonna refer them and say, call this line then to go?
Essentially, yes, that they are going to say, these are the organizations that we have compiled or worked with that do this. And we can transfer you to that person, but you'll need to go to this particular organization. This is what they do. And then they follow up a week later to see if it worked out, to make sure the person got what they needed.
That information published somewhere so that I'm a good set of people who we do food, but for other services, I'd be nice to be able to see that list to make sure I know all the other
Everything that
exists out there.
I do not know that is published anywhere. So you'd actually have to call the community assistance line, and they could give you a good overview of everything that's there, but it's not published.
Well, I obviously work from a different agency than most people here. I work for the hospital. So the problem that we run into a lot, and I don't know if you guys know the process, like if I'm sending someone to a skilled nursing home, that nursing home has to get authorization from your insurance company for them to go. And I've seen like a delay where it will take days for them to even just tell us yes or no. And so then that person's sitting there when they're medically stable for days. I didn't know if you guys have what's your process? Is there any way we could speed it up?
So I'll speak to that. This is James Johnson. So by requirement, there's a standard for standard authorization requests. I believe we have up to 14 days, 15 days. Don't quote me on this. It's actually in our provider handbook. So it's pretty consistent among all three plans. So given that we have about 14 days, I'm just going to use 14 because I'm just stuck on that number for some reason, to render a decision on an authorization request, it is pretty much preferred that providers understand that we have that amount of time to make a decision. However, if it is something that is considered urgent, or like in this example, you want to discharge a member to skilled nursing, and maybe that has to be done within like 72 hours, the best way to actually submit an authorization request at that point is to call us. Because if you go through any other avenue in terms of faxing the request in and faxing all of the clinicals, and you don't indicate that it's an urgent request, we're going to look at it as a standard request, and at that point we have up to about 14 days. Now, obviously, we don't want to take the entire 14 days to make a decision, but it could actually be that length of time or duration before we actually get back and render a disposition on the case. It is upon obviously receipt of medical information to justify medical necessity, all that good stuff. But if you have all that information in front of you at that particular moment, and you have a situation like this where you want to get someone into a skilled nursing facility within a matter of days, the best avenue is to call us.
I'm also from the hospital, so I'm glad to ask that question. We have had increasing amounts of, with the patients going to skilled nursing facilities, we have been told, it used to be if the patient had Medicare, Medicaid was their second payer, they could go to a skilled nursing facility and they didn't qualify under the Medicare, they didn't have enough midnights or whatever. Medicaid would kick in and do that. Now we are being told that that's no longer correct, that they don't qualify under Medicare, they don't qualify under Medicaid. That changed January 1.
I haven't had problems with that.
Yeah,
We've been told that repeatedly. And we had most of our skilled nursing facilities that we've referred to, that's what they've been telling us. So that did not change.
Have they been told that by the MCOs or by?
They listened to all three of the plans that said have told them that. So I'm wondering who they're talking to, because that really leaves a group of very vulnerable people that need not necessarily Medicaid long-term care. They need a skilled bed for 2 weeks or 3 weeks to then be able to transition back home. And they're not saying that they can do that they're not eligible. Who should we talk to when that situation comes up?
I'll give you my card.
Okay, that's good. Thank you.
If you wouldn't mind, could you send an email to our Heritage Health account so that we can look into that? If you're hearing it from multiple places in all three MCOs, I'd like to look at it from a state side.
Okay, I
So
will
if you can give us some information. Don't give any patient information, obviously, unless you send it secure, but
Okay.
Are you referring to Lincoln?
Couple
Yeah,
questions.
There's been multiple of them, so that's why I was thinking they seem to know something we didn't know. So,
Maybe the nursing homes need educated on how to bill it or do something.
they've been told that when they call in. I know that even I've had 2 of my case managers call and they've been told the exact same thing. That changed January 1.
Any other questions from the audience?
Yeah, I have a couple from the computer. Sorry about that. Is there a fact sheet available for assisters or members to use that says whether they should contact Medicaid, Heritage Health, or the health plans for certain questions, categories of questions, things like that?
we haven't separated categories
Mhm.
in that instance. We have lots of fact sheets. There's tons of one-pagers online that could answer some questions. There's also FAQs. But in general, people can reach out to that Heritage Health account at the state because we can filter it through to all of the health plans
Great.
very easily. So that would give them a one-stop shop.
All right. In passive enrollments, how has the information been disseminated to members? Feels like, yeah.
They'll receive a welcome packet from the health plan that they were enrolled in.
Mhm.
And I believe on their letter there, it will say you can switch health plans by this date. And it has the date filled in, whatever their 90 days is.
Great. I think that's it.
Okay.
Eric, do you have anything you want to add?
I think I'm good.
Okay. All right, let's give him a round of applause. Thanks for coming. Thank you guys for coming. Sorry that we didn't. We'll send out some emails and stuff of what we collected today, so we can do that. Please make sure that you sign in on a sheet that have your email. People who work here, please help me put the chairs away. Thank you guys.
Thank you.
Thank you very much. I appreciate it. Thank you. Yeah.